Our new program is the Pathways program, where we're streamlining our resources to patients through the hub. And basically, I'm using the social determinants of health survey on all of our patients, and that's where they're able to express on the survey if they have food insecurity, transportation, utilities, safety, any areas of concern. And then the providers at the clinical appointments are also talking to these patients and finding out more information. And if anybody is identified as having a need, then I am able to come in and talk to the patient, get a little more details and information, and then send the referral to the Pathways program to help connect these patients to different benefits that they may not even know that are available to them, and just really help them find the resources that they need for themselves and their families.
Taking the concepts of the Pathways care coordination, we're using that to implement into our other care coordination programs to really streamline how we're getting people connected to the resources, and then also breaking down social determinants of health and really focusing on what barriers people have in our community and how can we fill in those gaps across the board, not just in one program. But if we figure out how to fill in a gap in a care coordination program, it's also going to probably fill in a gap at the clinic level. We also have a multicultural advocacy team, and that also helps them fill in the gaps as well. The team really works with the immigrants and getting them connected to resources. So we have immigrant legal services. So if people need help getting a PO box or they need help working with their employer, we have advocates that can help advocate for them. The HRSA grants have really helped us leverage those partnerships in our communities, and then also being able to have staff that can go out and be the boots on the ground that is building those relationships with our community members, with our community partners across a large region. Our service area is 900 square miles. And so we're able to leverage staff throughout the region and clinics throughout the region to really support the community.
In our community, we do have a lot of elderly people and people who are aging and perhaps do not have the family or support that they need. And so we're able to reach out to those patients, give them the extra support and attention that they need, and connect them with different specialists, outside of our rural area. They may have to go to another town, which is, a couple hundred miles away, and connect them to the specialists and the appointments that they need, and arrange the transportation, or, get them the gift cards to buy the fresh fruits and vegetables, or help them sign up for a program that may help them with their utilities.
I think we're just really appreciative of the opportunities that HRSA's given us to be able to break down barriers in our rural and frontier areas. One of our clinics, Basin Clinic, is a frontier clinic, and it's 200 or 2 hours from our nearest hospital. So being able to have supports in the community for people if they're having a medical need or if they have a social need, they don't need to travel 2 hours to get service. We're able to provide that in the community, which has been great for our community members.